Welcome everyone to our virtual chat today on we're veering off course a little bit from a Q&A to talking about the change, or the change in quotes, maybe I should say. And this has sort of been something we've discussed for a while, is a topic that we really wanted to get into some of the details that go beyond just symptoms and talk about what this phase of life is really about. So Dr. Rosensweet is here with us, and I'm so excited because he actually was the one that had brought up the idea of talking about the change. And so it's really going to be fun, I think, to get your perspective, especially the male perspective, but also as a physician who's been seeing patients for many, many years. You've probably heard it all. So the pieces of the change, or pieces of menopause that are all about transition in this journey, are something that I'm sure you've heard from patients for many, many years over time. So welcome. Thank you for being here.
Hi, Joe. Good to see you.
Hi, good to see you too.
Good to see all you folks out there in virtual land.
Yes. Yes, virtually.
Looking, but I don't, I can't see you yet. Let's see. Oh yeah, there you are.
Yeah. There you are. There you are. I know, because I sort of tag our conversations with questions and answers. We get a lot of replays, more than I think, people being here live, just because of schedule. So
Sure.
it's a very special one. I think people will have to really watch the whole thing to get the gist of what we're talking about. But we get a lot of good feedback from the replay, so that's exciting. So let's see, how do we even begin the change? Where did this word, there is this word that we think about, right? Like the word, the change in quotes, is often kind of like, it's really associated with menopause. And we often sometimes even say, I'm going through the change. So how did it start? I don't know
No,
if you have any
I
background.
haven't heard this particular word until you brought it up recently. I haven't
Really?
heard the change in decades.
Really?
I was growing up,
Yeah.
I was a young doctor. Menopause wasn't known as menopause. It was known as the change.
So I'm rehashing something.
And but I love how it's called because there's so many different ways to look at it.
Mhm.
And to me, there's the life stage way to look at it. Like, you're a kid, you're born, you're an infant, you're a child,
Mhm.
first 7 years of your life. And then there's a change from there's a new life stage beginning at 8. And 8 to early adolescence is really different. And
Mhm.
then teenagehood is really a different life stage for
Yeah.
folks. And
Mhm.
then the 20s under classic, if someone really makes it through the first life stage and is really grown and is healthy and is grounded in themselves, in their 20s, traditionally it's the family time.
Mhm.
Not for everybody,
Mhm.
but it's a time to mate and have children, and the human race goes on and on.
Mhm.
And then there's the raising of the family time. That's a life stage.
Mhm.
And then the kids leave home and they're gone. And many people, it's a shocker because you've done a good job. You raised healthy kids, and now
Yeah.
they're on their own and they've got their own lives going. Then
Mhm.
what? And well, these are known life stages. What do you do now?
Mhm.
Well, from that point on, there's a wisdom tradition that says this is the beginning of preparation for your spiritual growth. Not that you're not growing big time prior to that, but now the focus of the life changes from householding and working and daily chores and running hither and yon to what do I do now?
Mhm.
And under ideal circumstances and in certain cultures, this is the time we really cultivate the heart and the soul. Cultivate the heart. What does that mean? That whatever we haven't learned about loving, we learn more and more and more. Whatever we haven't learned about coming all the way into our own being, and instead of being outside of our being, lost in our thoughts, in our activities, where we're focused either on our brains and what thoughts are running through there, or the busyness. This is the antithesis of being embodied and being present and in the moment. Well, good on us. For the first 40, 50 years, we need to be busy and do things. But it doesn't serve the whole lifetime. And if you haven't been cultivating the skills, all of a sudden the kids are gone. It can be a real shocker to the system, a real shock. Because you've been involved with activity, well, going here and there, and I got to do this, and then it's this constant interaction with your mind. And you're taking a walk and you see a tree and you're thinking, God, did I turn the stove off? And I've got to go shopping because this weekend we're having guests. And then next month I've got a plan for this work thing. You're in relationship to your own thought process. Mm-hmm. And that interferes with being present with the walk you're taking, or the person that you're with, or the spouse that you're with. Well, this natural progression of life, as you're passing through the householder stage, and some people have called it the empty nest, that's a natural function. And now you're in a different phase of life. And in this culture, we don't prepare for this. So the kids have gone, and all of a sudden you're faced with a lot of time. Not everybody. A lot of people are still scrambling just to make ends meet. Mm-hmm. And habits that are challenging to your well-being. For example, we're designed to feel love. May I repeat that? To feel love. As a matter of fact, if we actually feel our own self, our own heart, we're actually capable of feeling our own heart, we feel love. Or the corollary to that is, if you're feeling love, you're feeling who you are. Mm-hmm. And we're also capable of feeling our own soul. And when we do feel our own soul, we feel peace and joy. That's what the soul feels like. The corollary is, if you ever feel peace and joy, you are present enough and conscious enough and aware enough and sensing enough that you are feeling your own soul. You don't need to know that. The peace and joy and love is plenty. Mm-hmm. And then when you really get conscious, you become aware of the divine. You become aware that we're all part of the divine. I'm using that word. You can, use whatever word you feel most comfortable with. That's what being present is. So you're taking a walk and you're not thinking, oh, that's a nice tree. You're just seeing the tree and experiencing the tree. You're not in relationship with the second party called your mind. Oh, my mind. Mm-hmm. That's a nice tree. You're not in relationship with the tree. You're in relationship with the sentence going through your mind. Mm-hmm. So these are important skills, because there comes a time where the busyness no longer suffices. And if we're not doing what we're designed to do, we're not going to feel right. Mm-hmm. So people talk about a midlife crisis. The crisis is people haven't been dealing with the interferences to being present, the uncomfortable emotions and the unbeneficial thoughts, and we're multidimensional, so it's taking place on every level of our being. So they haven't been clearing the path for these distractions, and they haven't developed the skills to be present with what is and the unfolding of life, because there's a big distinction when we're allowing life to live us. Mm-hmm. That's a funny statement.
Yeah, I don't think I've heard that before. That's it's very obvious what it means, like right out of the gate. It's just, and I think a lot of women and men But women here would say, yeah, that's kind of what's happening in my world, especially coming into midlife when we're talking about the change and doing all these things, sort of trying to unbusy ourselves. For a lot of us, it's our busiest time in life simply because we are still caring for kids if we have them, also caring for parents. We are maybe at the height of our career. So many things. It's almost like this mismatch, like we know we should be sort of shifting to this other, evolving and carving out this time for ourselves, but life is living us. We're not really able to do the things
Yeah.
that.
The kind I meant, though, is different than that.
Yeah.
Athletes sometimes say they're in the zone.
Mm-hmm.
And how I interpret that experience is they're so one with what they're doing that there is no thought process. They're just doing
Mm-hmm.
it.
Okay.
The game is moving them.
Yeah.
They're one
Okay.
with it. They're one with it.
Mm-hmm.
That's where the most brilliant are performers or plumbers or anybody. They're just in the zone.
Mm-hmm.
Or some people use the analogy of the river when they really feel like they're in the flow. And what does the
Okay.
flow feel like? It doesn't feel
Yeah.
frantic. It feels like,
Mm-hmm.
man,
Yeah.
I'm floating down the river and it feels fabulous.
Mm-hmm.
Because we think of life as we're creating it.
Mm-hmm.
And there's many who feel that we're creating it.
Mm-hmm.
We create our own reality.
Mm-hmm.
But there's another way to look at it, that we're in co-creation with the divine. And when you're not, I mean, there's been times in my life, and I've heard this from others, I've said, Jesus, take the wheel, please.
Yes. Yes. Many
You know,
times.
that's not just a figure of speech,
Mm-hmm.
because when we really surrender to a certain extent, we're taken care of.
Yeah.
I first learned it in medicine. So this is sort of a sidetrack, but about 30 years ago, I'm in doing my standard consultations with patients, and I'm hearing things come out of my mouth, and I'm saying to myself, I didn't know that. I never read that.
Mm-hmm.
Where did that come from? And I became aware that I wasn't doing this alone,
Mm-hmm.
that there was the patient and myself and a third.
Mm-hmm.
I'm not naming the third. I've never seen the third. It's nothing
Yeah.
special. I think zillions of people have felt this. I think nurses have
Mm-hmm.
experienced like they're in the middle of a crisis and they just go automatic and everything, they just do it.
Yeah. Yeah.
And so the reason I want to say this is there are certain goals in this lifetime, and it's to come home to the truth of who we are. And we're really a spark of the divine manifesting.
Mm-hmm.
So the corollary is we're on a journey to discover that and become conscious of that and feel that.
Mm-hmm.
What does it feel like when you feel like you're in the presence of the divine and
Mm-hmm.
you're doing it with the divine and you're an aspect of the divine? So this is a goal, and one could say the change, because many women are just totally just shocked by the magnitude of the symptoms that are taking place when the ovaries stop producing these ovarian hormones.
Mm-hmm.
And can't sleep, mood going to pot, can't think clearly, and on and on and on. Hot flashes galore, really dramatic stuff.
Mm-hmm.
Well, when I was a younger doctor, I used to say, well, when someone tells me about their symptoms, that's wrong. We got to fix that.
Mm-hmm.
We got to change that.
Mm-hmm.
That's what I'm about. I'm a doctor, and they come in and they're having these troubles, and we got to change. Well, that didn't work. And so there came a time in my career where I started saying, why don't you just pause, forgive the language there.
Yes, I got it.
Yeah.
Yeah.
Why
Mm-hmm.
don't you just pause and try and study this? Try and accept it as what it is. sidle up to it and get present with what's going on here. And then I had my own experiences to deal with on top of dealing with patients. And I began to see that illness was the initial phase of a healing process, a profound one. And what it was about was it shook us up enough. It stopped our world enough, caught our attention enough for a reason. And the reason was to get us to ask the question, what's going on here? But the problem with illness is it wants the real answer. It doesn't want you to say, well, this is a B vitamin deficiency. Not when your life stops and you can't function well. There's more to it. And it wants the real reasons. And the real reasons are going to be related to things that really matter to you. Really matter. Like, for example, you're in Indiana or Illinois? You're in Illinois.
Yeah.
Like if the Chicago Cubs don't win the World Series next year or this year, you might feel a blip. I don't know your sports, but it's not going to be that big of a deal for you. You'll get over it.
Yeah. Quickly.
But there are things that really do matter to you.
Yeah.
Really matter. And that's what these shockers are about. They're for you to ask the question, what really matters to me? And what do I need to do? And the usual answer to that question is, I need to acquire information, tools, and practices that are going to heal what's at the foundation of not feeling well and not living I am. And that's going to relate to your emotions and your mind principally. And that's going to, if your emotions and mind are still dealing with undealt with emotions and thoughts that aren't accurate, are negative, then you're going to make choices. You're going to make perceptions and choices, you, me, everybody, that don't serve life. They don't serve your life. They don't serve your health. They work against you. So the change is a natural life stage, and it's shocking enough to get people's attention. And I've wrestled many times with, well, what's your answer, David? You give women and men hormones. What's your answer, David? Better living through biochemistry?
Yes, I've heard that too, right? Yeah.
Or you're just going to use some sophisticated biochemistry or some of the most powerful molecules that the human being knows. So I'm concerned about that at times. And that's not what I've done with my own life. I really, from my 30s, I decided to really dig in and get help and really unearth some of the repressed emotions and non-beneficial thoughts that skewed my perception and led to funky choices and behavior. And that's really what's called for. You know, if you're shocked, there's things your being wants. And what are they going to relate to? They're not complex. You want to come home to the truth of who you are. You want to feel your own heart, thus feel love. You want to feel your own soul, thus feel peace and joy. You want to be outward perceiving enough, not inward caught in a cycle here, that you can see the beauty of creation, which is so phenomenal. It's just unreal. Human beings, starting off with human beings are so gorgeous, it's unreal. It's real. And then nature and life itself. But in order to see that and perceive that and be nurtured by that and feel at home in there, you got to feel at home in yourself. So you got some work to do. So the change is about some work to do. Replenish the hormones, but don't leave out the work. Find your teachers. Find the practices that are going to deal with your emotions and your mind. And you're going to unearth some things that if you haven't already, they're going to shock you. What's been repressed, the fear, the sadness, the anger, the shame, the guilt, the emptiness, the loneliness, the meaninglessness, the hopelessness. Mm-hmm. What it feels like to be separate from self and separate from the divine. That's what it feels like. And you could be repressing this all this lifetime. Mm-hmm. And those are associated with thoughts that aren't correct. Oh, this world's going to pot and we'll never save it. And I should hate my neighbor because that's an effective change technique. Let me go into battle.
Mm-hmm. Yeah. Yeah. Especially in this day and age, right? Yeah. With everything going on. Yeah.
And it leads to global choices. Like some people think that they should harbor all the resources and just take it from the general population so that the general population doesn't have enough for rent or houses or food or education. It's just, it's one of the worst that I've seen in my lifetime. Some of the behavior of some of the oligarchs in the United States, and the corporations, they're amoral.
Yes.
They're sociopathic instead of being there. So, that's what it leads to, because in order for people to make good choices, that we're all in this boat together here.
Yeah, right. We're not alone.
Together.
Yeah.
We got to share the resources rather than hoard the resources. Well, you have to have a heart to do that. So it's serious. The whole earth is poised on whether we're going to make it or not. And so menopause and the change is a force for the good as far as I can see, because in my lifetime, there's a huge difference from when I was a kid. Like I was seeking knowledge and help when I was a teenager. I was successful. I had a good life. I had a good family, but something was missing. And I was seeking for wisdom. I was seeking for teachers. And they were very rare, or I couldn't find them. And they certainly weren't living on my block.
Yeah.
In suburban Detroit. And nowadays, there's resources. And there wasn't very many people that I ran into on a day-to-day basis that were also seeking their own healing, their own spiritual growth. This was not language that was being used.
Yeah.
The language my granddaughters use these days, which just blows me away. And then in the course of my lifetime, there's been an upsurge to where millions of American women, primarily, and men, are interested in becoming a better person and learning how to be kinder and more golden rule-ish. And really, and their caring is developing, their heart is developing. They care about others. And they act, and they're seeking, oh my God, from Alcoholics Anonymous to thousands of different approaches.
Yeah.
And the subjects are always the same. Do the great work. Unearth your own pain, accept it. Thus, you're going to learn unconditional love of yourself. And that's going to open you up, and that's going to give you access to the treasure of life itself. And that's what the change is about. Householding is done. You're on your way to prepare for ascension, but you're not there yet.
Yes.
You got some work to do. And if you embrace that work and take a few hormones, you're going to be doing what the change is calling for. Spiritual growth.
Well, and it's interesting what you said about the biochemistry, because I've, read a couple of, listened to and read different pieces from people in the menopausal space saying that if you take hormones, which I just find this interesting, if you take hormones, you're sort of that you're not going to feel that sort of, like you said, symptoms kind of drive us to change. And there are some that are sort of, I guess maybe touting, maybe go natural, like natural meaning don't take hormones, because you're going to miss this window of, it sort of menopause calls you to do this, and you're not going to feel all those feelings. And it's interesting because I take hormones, as you know, and I feel all of the feels, all of the things that you've said. Even with hormones, I still feel at this age, at 50, now I just turned 51 over the weekend, that I'm totally like knee deep in this journey, this evolution, this spiritual journey of just trying to, become more and more and more in alignment, and saying no more, and putting up boundaries, and, really, again, becoming, the golden rule, becoming more golden, and just aligning like with the planet, with people. It's just, you can feel it so deeply. And I have never found that hormones have dulled my call to do that. So, so that's why I feel like it's just interesting, because I think either way, hormones or not, I think what the hormones do, especially if you are in this phase and you're sort of without the hormones, at least for me, I can talk from experience and from what I've heard from women who feel like they're going crazy, they're going out of their mind, they can't stand their spouses, like everything is just so off, because hormones, as we know, are so powerful. And you just look at kids going through puberty, we can see that example. And so this reverse puberty, if you want to call it that, is sort of that same, this sort of, it's tumultuous for a lot of women, and you're kind of not yourself. And so getting some hormones on board that sort of helps you to sort of ride this wave with a little less angst, and not like hate on your spouse or your person, because you probably don't hate on them. Obviously there's a lot of people that have put their relationship to the side. So maybe they do need to do some work on that at this phase. But if all along things were pretty good, and now all of a sudden you're just like, I can't stand the way they breathe, or they chew, or they look at me, which I've heard from many, many people, there's something else going on. So it's almost like these hormones they give us that sort of, they help us be ourselves and have the energy and the equipment, and embrace the tools, and have the motivation to seek out the tools to help ourselves. So I don't know if you've heard anything like that, hormones, not versus hormones.
I love what you're saying.
Yeah.
I think it's the optimal way to go.
Yeah.
And I'm thinking about, well, what's the bottom line? Well, if as a soul, the deepest part of you as a being, your primary intent is to heal and come home to the truth of who you are, it's beautiful.
Mm-hmm.
And I think that is who everyone is. And I think what you're saying is very, very important, because if you go off the rails, it doesn't support your healing process.
Mm-mm.
When things get out of control with a certain level of severity, people are scrambling just to survive.
Yeah.
So in that case, the hormones are going to empower you, and you're not going to feel any less. I mean, think of a young woman in her 30s.
Yeah.
Does she feel less? And yet she's cruising on a lot of hormones there.
Mm-hmm.
A young man, 20s, or a young woman in her 20s. My granddaughter, who's 22, she's cruising on a lot of feelings, and she's working it.
Yeah.
It depends on, and there's a lot of hormones there, more than she'll ever experience in any other time of her life.
Mm-hmm.
It ain't the hormones.
Mm-hmm.
The underlying intent of the being. And I think our underlying intent for all of us is really to come home to the truth of who we are and to the divine.
Mm-hmm.
But, a lot can go astray. And we're still in very primitive times. But I love your point, Jill. They don't blunt anything.
Mm-mm.
Your primary intention is to become a more loving person. The hormones are just going to help you.
Yeah.
They're going to give you the vitality. They're going to help you with your vitality. They're going to help you with the vibrancy. And that doesn't quiet the emotions down. That brings them up.
Yeah.
But if you're like If you're absent of progesterone, there's some women who are going to feel like they're going crazy. Well, how does that help their process?
Yes.
They're going to be dealing with something that's excessive. And they don't need, like one of my mentors made a point over and over again, is it was never meant to be this hard.
Mm-hmm.
We can do plenty of spiritual growth and not have it be so shockingly abusive and harsh and
Yes.
intense. It doesn't help.
Mm-hmm.
None of that stuff helps.
No.
In fact, I think it's detrimental
Yeah.
to being able to focus on the growth part of it.
Mm-hmm.
When you're feeling pretty decent and your spouse turns towards you and said, I didn't like how you said that to me. That was awfully mean. If you're feeling pretty reasonable, you'll gulp. I'll gulp. I'll
Mm-hmm.
feel like, oh my God, she's right.
Yeah.
And it'll hurt because I was doing something that was not okay.
Mm-hmm.
Not only that, there were roots. There was
Yeah.
reasons why I was doing something that's not okay. So that
Yeah.
makes the exploration process a lot easier
Mm-hmm.
rather than if she's judging the living heck out of me, which doesn't happen in my life. I'm with someone who's really very, very
Mm-hmm.
savvy in this regard and very
Mm-hmm.
responsible. So I agree with you, and I'm so glad to hear it from you. And I think it's
Mm-hmm.
so important that women hear this message that you can be plenty spiritually active and growth active,
Yes.
and more so when things are reasonable and you're not having to contend with really harsh and abusive circumstances. You're just going to have to be in survival mode so thank you, Jill.
Yeah.
It's very important. It's very important.
Well, and what you said about the resilient or the just really being reasonable. I mean, I think that you really hit that just straight on because it's such a, so many women will say, I mean, including me, when I wasn't on hormones, you're just so much more reactive. I mean, and that's not true for everyone, but for most people, your resilience is just two things happening around you is just down because you don't feel all that great. Things are off, just like you would if anything else in your body is off, nutrient wise, neurotransmitter wise, we feel off. We don't have that same bandwidth to handle things when they go a little bit awry. And this time in life is already a little awry with not only the hormone changes, physiological changes, but our families and the responsibilities and maybe our job and things like that. I mean, you and I have talked about the fact that women have had to leave their jobs. We had this, Dr. Rosensweet and I were interviewed last week. We were on a podcast with Dr. Louise Newson, and the three of us were talking about that. She's done surveys on divorce and people leaving their jobs because that's how critical this time in life, this phase in life is. So I'm glad that we're talking about this. And it's not that the hormones, as usual, are this like, it's not a quick fix. It's not a Band-Aid. It's really just about optimizing hormones in our bodies so we're more balanced. So we are ourselves, how we should be. But there's a lot of fear. And that's the thing I had said when I was sending you an email yesterday about today, there's so many women. I think part of it is us where we do say, we walk this fine line where we want women to prepare for this time in life. So we're trying to sort of say, hey, these things are coming. They're going to happen. It's going to happen to everyone, and say it in a way that is helping kind of pushing them to, like you say, shop for your provider, get prepared a little bit earlier. And then there's sort of this flip side where we scare women and women fear this time in life. And there's like dread and I don't want this to happen. And I'm so nervous about it. I'm so scared. And I think the change often is seen as like this thing that's just like, oh, it's going to be terrible. And I wish it wasn't so. I think there's so many wonderful things that come out of this time in life, but it is going to be a little bit bumpy. So we want to kind of be honest about it as well. And if we prepare and like, as you've talked about, getting the tools, getting the resources, getting the teachers that can help support our emotional side as well, our spiritual growth, as well as the physical changes that are happening. Seems like that's kind of the best of both worlds.
I'd like to address what we've been hinting at, and that is the changes about spiritual growth, and you could have dread about it. And I'd like to get very, very specific about what I mean by it. What are the mechanics of this? What you're facing. And before I do that, everything that you could be dealing with in midlife, you could have been dealing with in your 40s or your 30s or your 20s or your teens, because the exact same material was there. You just postponed dealing with it. You got busy. You, quote, fell in love, end quote. You had all these activities. Like, for example, my granddaughters have not put off their growth process at all. They're right in the midst of it. Bless their hearts. They're more fluent in the vocabulary and in the process than I didn't pick up on this until I was in my late 30s. It's a natural part of life. And in a healthy society, the elders would be guiding the young people when they were in their 5s and 8s and 10s. And there'd be many other factors. And I recommend, if you want to get an idea of how this is expressed by an Inuit, Larry McMurtry, I think his name is, he's on YouTube. He's an Inuit, and he gives a TED talk about what a more natural culture is, where the young people are mentored by the villagers, where every young man is assigned a mentor to help them with the ways of men, and every young woman, girl, it's not young men, it's boys and girls. Mm-hmm. They're assigned someone who's not their parent, because this spiritual growth is part of woven into their life, into their lifestyle. Mm-hmm. Why the change seems so abrupt is because there's several people who just never faced what they need to heal. So what do you need to heal? And so what are you going to face abruptly? And that's why the change can feel so abrupt. But you could have faced it in your teens. It was erupting in me as an early adolescent. Mm-hmm. I hadn't a clue about what to do with my emotions in my mind, mm-hmm. or the choices I was making, or how I was experiencing relationship, or the trouble I got into in relationship because I didn't know how to navigate them. Mm-hmm. And I had so much personal discomfort, even though I looked like a normal guy, right?
Yeah, right.
And I could have done it again in my 20s when it was all amplifying, or my 30s when in my 20s in medical school. Mm-hmm. And oh God. And but I didn't have the resources. I reached out, but I wasn't connecting. And then in my late 30s, my mid 30s, after a divorce, I said, I don't know how to love. This is bad. I'm going to devote my life to this. Mm-hmm. Doctor second, heal first. Mm-hmm. I had broken up a family, my son, and I knew that was very severe. Mm-hmm. I looked normal as a normal young doctor. Oh, yeah, great. Loved by my community and couldn't keep a marriage together. And I knew it was me. Mm-hmm. So at that point, I sought out help in earnest. And because I was committed to it, because I really meant it, Mm-hmm. That's the thing. You got to really mean it. And a lot of people are inspired to take on their spiritual healing because they've broken down. Mm-hmm. They've caused a lot of pain to themselves and others, and they get it. Alcoholics are notorious for this. They cause so much damage to themselves and their families and their lives. And then there comes a moment where they hit bottom. And some of those people are some of the strongest and most committed people of all. They get it. They know what life's about. It's about healing. So if you've managed to not do one of the things, major things we're here on earth to do, which is to heal and come home to the truth of who we are, and you've been putting it off, men and women, because men put this off too, midlife crisis. Oh, he had a lover and destroyed his family.
Mm-hmm.
I didn't do it that way, but I dismantled it in other ways.
Mm-hmm.
Midlife crisis. Yeah. Put off his healing process and until he caused some real damage. So what is it that I'm talking about? We come to earth as sparks of the divine manifesting. When my son was born, I could see this was the closest I had ever come to God, because I saw, and I was certain of it, that he had just come from God.
Mm-hmm.
And I knew it. And a lot of mothers and fathers know this. And it was astounding to me. And we come with all that love, with all that beauty, with all that potential to be living angels and empowered beings that can heal the earth and ourselves. And that's who we truly are. We're sparks of the divine. We also come to earth with some unfinished emotional business that shows up very early in life. Now you could say, well, my parents did it to me. No, you came to earth with it. They helped you by whatever neglect. And I know it's a funny way to put it, but
Yeah.
unless
Yeah,
you
it
learn
makes
how to
sense.
take 100% responsibility for your own life, you don't get anywhere.
Yeah.
And
Well said.
that's how I see it. I came to earth with this stuff.
Mm-hmm.
And what do you come to earth with that's not yourself? Unhealed emotions, fear, sadness, anger, shame. That means something's wrong with me. Guilt. That means what I do is wrong. Emptiness, loneliness, meaninglessness, hopelessness, and even some death energy to boot. I'm not going to define that right now. Now, these are words applying to feelings. If anyone's ever felt their feelings and felt those feelings, they know it's not the words that are relevant, it's the feelings that are relevant.
Mm-hmm.
We came to earth with these, and we're multidimensional, so anything that's taking place on any level that's significant is simultaneously taking place on every level of our being.
Mm-hmm.
So they have thought representatives, like I'm no good, I don't deserve to love, I don't know how to love, I'll never make money, I'll never succeed, there's something wrong with me, I'm deformed. You know, these are unbeneficial thought patterns that aren't the truth about who we are, and they're linked up with those feelings. And there's biology to reflect it as well, because we're multidimensional and it takes place on any level, it takes place on every level. It's represented in our energy field. There's seers who can see it in our energy field. It's more multidimensional. But the leverage point, because this is the real question, well, how do you heal that? Well, the main leverage point for many, not all, is unearth the emotions. They're being repressed because we live in a culture that we were taught to repress our feelings. That worsens them.
Mm-hmm.
It scares us. We're learning how to separate ourselves from our own experience. In fact, we're judging uncomfortable feelings as bad.
Mm-hmm.
Well, in any healing process, it's got many facets, but one of them is to use safe techniques to unearth these feelings. That means you don't hurt yourself in the process. You do it alone primarily or under the guidance of a skilled therapist or guide who really knows what they're doing with emotions. You don't hurt your body in the process. Like I've seen people throw their fists through walls because they're angry. Well, that's not safe for your body. So you're not going to heal. That's not going to help you heal.
Yeah.
But if you're screaming into a pillow, your anger, that is safe. No one's going to be hurt by that, except maybe the pillow. But they're
Yeah.
designed for that. They love it.
Yeah.
It's a fabulous experience, these pillows. I talk to them.
Yes.
Assured me that
They enjoy it.
they enjoy it. And so you learn information and tools to help you unearth these feelings and heal them in a safe way. And to get cut to the chase as far as uncomfortable feelings, even if you're loaded with fear and shame and guilt, it all comes down to the same thing. You become conscious of those feelings and you feel them in a safe way. And you accept them. You breathe and feel, and you're the big tent. It's like, just picture a 5-year-old girl or a 5-year-old boy comes running into your room right now and they're screaming at the top of their lungs. And there's a couple ways you could behave. You could go, you stop that right now. You're never going to become an adult if you are just screaming like that. You learn to control yourself right now. That's choice A. Here's choice B. Come here, sweetheart. Sit in my lap. I can see you're having a lot of feelings. I'm just going to go silent. I'm just going to hold you. You keep crying. You're doing a great job. Or you screaming in my shoulder. You're having feelings. And I'm just going to hold you while you feel them. It's good that they're coming up. It's beautiful. What choice does that child want?
Yeah. Very, very good example.
Yeah. And that's what we learn to parent ourselves.
Yeah.
We learn to allow these feelings to come up in a safe way. That's usually sitting in the comfort of your own home or in a bedroom or something. And all you're doing is feeling. And someone could walk in the room and you could be feeling terror. And they could say, dinner's going to be ready in 5 minutes. You say, okay, I'm going to be a little late for dinner. And then you go back to feeling terror because you're still responsible for your behavior and they don't need to know that you're feeling terror.
Right.
And you just breathe and you feel it.
Yeah.
And you breathe and you feel it. And you breathe and you feel it. That happens to be an activity called acceptance. You're accepting what's going on in your actual self. That's learning unconditional love. Acceptance is one facet of unconditional love. So you're growing yourself up by learning how to love unconditionally. You're accepting the pain that you're carrying in this lifetime. You're not projecting it onto the Democrats or the Republicans. You're not hoarding things because you think others, you need more resources than others because you're frightened and you need to grab up $80 billion and fly off into space with it. You don't think like that. You want to share everything.
Yeah.
You're learning how to accept yourself. And then there's some techniques for dealing with the mental thought processes, for recognizing the language in your head that's floating around there. I'm no good. And once you're really breathing and accepting those feelings, you can say something like, the belief that I'm not good, it's not true. I'm living energy of love. I'm a spark of the divine manifesting. I came to earth with some unfinished emotional feelings, and I'm learning how to accept, and I'm learning how to unconditionally love my own self. I'm a child of God. Simple techniques that you can do. You can do it anywhere, really. You can be at work and all of a sudden you get this eruption of feelings and you're doing your work and you're sitting there and pausing for a moment and just breathing and feeling. And someone comes up to you and say, we need this report right away. And you say, yes, I understand the importance of that. I'm going to be on it in just a minute. I'm just taking a few moments rest here. You don't have to have funky behavior. In fact, the more control you get over your own feelings, the more social, you're better. You're going to be able to navigate your social environment much, much better. Your work environment, your family environment. And once you get responsible for the pain that's in your own being, you're not going to project it out.
Mm-hmm.
So when your spouse says, you are our senator,
Yeah.
you're going to go, is that so? And they're going to be left with, oh my God, they didn't get triggered. And now I have to look at myself. Zoe's done this with me on several occasions. She doesn't react.
Yeah.
And all of a sudden I see myself and I go, oh God,
Mm-hmm.
I was
It's
grumpy there.
brilliant though. And I think one of the things that you said, first of all, I feel like we've been in a meditation with you for the last 20 minutes. Like I feel so zen. I think everyone else will when they listen to this. I'm feeling like there should be like the menopause method meditations coming out at some point because it's so true. It's these things that, like you said, the change and the feelings and all of these things that we're facing have always been here. We just have busied our lives. And I mean, it's really profound the way that you said it because it's, as I'm listening to you, I'm thinking that's 100% true without a doubt. And we all know that the busier we are, the less we can pause to reflect, which I think is why, even if people that say they believe in meditation or don't believe in it, whatever you like to do, it allows you those 5 minutes or 10 minutes or 2 minutes to just be. And, you don't have to do it the right way or whatever, but it's just about pausing, I think, at the end of the day, and starting to recognize this and the acceptance, because if we keep pushing it off, the change from a physical perspective is really hard, but emotionally too. It's like we're just sort of like, oh my gosh, now we've got to face all of this stuff that's so big. It's been coming for so long. And it's really, thanks for sharing your story, even about your own personal journey, because like you said, from the outside looking in, you are, great doctor, great human being, all the things. I mean, we see you as just this, all I get here from the community members here is, like you're so calming, you're so knowledgeable, you're so trustworthy. It's like all of this, so grateful to have you here. And you've done all this work on yourself, but you recognized way back there was this thing that was kind of coming between you and love. So it's super, cool to sort of see your personal journey as well, because we're all on one and we do kind of push it to the side. And we need to make room for it, I think. And this is going to force us to do that. And if we don't, we do end up, it keeps coming back until we face it. I don't think it goes away. It's that, and I know there's a saying, I can't remember it at the moment, but it is those things that just you never resolve. They're always going to come back in one way or another. So best to say, hey, okay, if I haven't looked at it now, perimenopause and menopause are going to force me to do it. Maybe I ought to do that. Which is why we see women coming out the other side saying,
Yeah, right.
wow, right? I feel amazing. I'm confident. I feel so good. I believe in myself. I feel valuable. I don't care what people think of me, and not in a nasty way where I'm going to just
That's
run
right.
people over, right?
Right.
Um, and I know we're close to the end, but maybe just because coming into it, the other thing that does come up, and I had sent this to you too, is, and I think it's different for men and women. Oftentimes we see men going through, I don't think we characterize it as andropause, but we say midlife. Men, it's, distinguished, they age well, they seem to just age differently than, well, for a lot of women, not all men, not all men. I actually thought of it yesterday. And then women, it's like seen as like frumpy, dumpy, not as valuable, gray haired, like our gray hair we're told to kind of color. Men, they let it go because it's so distinguished looking. There are these societal messages. And I was actually thinking last night, I was watching a TV show and it was a company called like For Him and For Hers or something. And the one and I don't know exactly what they do, something with women's health and men's health. But the commercial for women came on and it was showing this kind of overweight woman who was suffering from depression, and we're going to treat her for depression symptoms. Then the commercial came on maybe two commercials later for men. And it was, it was talking about a man not having an erection. So we're going to give him Viagra or whatever it was. And even that, I thought we both suffer from depression, anxiety, but the commercials and the messaging is so different that men are seen a little bit differently through midlife. Maybe it's changing, but women often it's seen as like we're not as valuable now. And it's not as, we're emotional, we're hysterical, we're, all of these other things. And so there's a lot of fear, I think, for women that like, now I'm over the hill after when I go through menopause. What is your, I guess, I don't know, we don't have a lot of time. Maybe we'll have to table it, but have you heard that when you've talked with women? Do you feel like that's something that's sort of come up in your work with women?
Oh, such a minor point you're raising here. I'm checking my schedule.
I know. Well, should we table? I know I
No,
didn't
I
realize it
can
was that
do this.
late.
I can do this if you'd like.
Okay. Yeah. No, if you have a couple minutes.
Because for one thing, I love to relax and, and you just happen to bring up quite a subject there,
I
Jill.
know. I did, I guess. I was thinking, this might be too big.
There's a lot of ways to look at what you just said. And so I want to give you some of the different ways to look at what you said.
Mm-hmm.
Culturally, we're a mess. I mean, in general.
Yeah.
This is not Larry McMurtry's Inuit culture. And, some of these messages that come to women and men, they're coming from 12-year-olds. People have never made it past 14, to be sure.
Yeah.
Where what they see is they want youthful beauty, youthful bodies. And because they're stuck there,
Yeah.
never made it beyond there.
Yeah.
I know that's a simplistic way to put it. And I'm just giving you my opinion. I'm sure
Yeah. It's
would have a
great.
lot of different ways to look at this. But that's one thing I see. And there's a lot of men who are stuck there. And my experience, because I've been so involved in personal growth for so long,
Mm-hmm.
when I started out, 90% of the attendees of these large seminars that I were women.
Yeah.
I was changed over time. Now 60% are women.
Wow. That's
I just
impressive.
a couple of years ago, I did this. We had a group of 72, and we spent 6 months in this, and we met 5 times for a week, and 60% of them were women, but 40% of them were men. And
Wow.
it was really different for me. It was so heartening to see that. And these were beautiful men. These were men who really cared about it. They cared just as much as the women did.
Mm-hmm.
So there's new things happening on this planet. And there's a men's movement in general that's been rising. And so women have pioneered this.
Mm-hmm.
That's for sure. And men have joined. So the great work is being done. I like to call it the great work because it is a great work, and it's an essential work, and it's a lot of work.
Yeah. Yeah.
Another way to look at it. I was a real adventurer, a hitchhiking adventurer when I was young, and I hitchhiked all around the United States, and I hitchhiked around Europe. And it was a big difference to me when I was hitchhiking around Europe when I was 20. I started seeing that the older women were more beautiful than the younger women. Not universally, but there was a lot more. And the older they were, sometimes the more beautiful they were.
Mm-hmm.
And that sort of turned my head around.
Yeah.
And it's oddly enough, and I was single until a while ago. And when I was doing online dating, I could see 60-year-olds too young for me.
It's showing up again for you.
Too young.
Yeah, that's what I mean. Like it's showing up again. I don't want the younger, right? Yeah.
I don't want the younger.
No.
I want my age.
Yes.
And there's another thing. I'd like to look at another element. Ultimately, life in partnership comes down, no matter it's heterosexual, same sex, whatever it is, it comes down to intimacy. And we could boil intimacy down to, what do you like to do at night? Do you like to snuggle? You like to sleep embraced?
Mm-hmm.
You like sexual intercourse from time to time? Sexual expression from time to time? Do you like to hold hands? It's intimacy.
Mhm.
And then what I learned about myself, starting about 20 years ago, is that the quality of the intimacy was dependent on love.
Mhm.
And love was dependent on several factors, as one of my favorite teachers of all time defined it. Love is a series of choices one makes to have the experience called love. And love involves caring. Well, young people, properly so, are self-involved.
Mhm.
They need to be. They need to care about self. Sometimes they're called narcissistic, but that's judging them in a way that can interfere with their actual growth and can throw them off. They need to be self-involved.
Mhm.
And then if you grow properly, you become other involved.
Mhm.
And caring becomes far more prominent than being loved. And I noticed this in my own life. I always thought that life was about being loved. And then I learned about myself. Being loved was nice, but
Mhm.
it was loving where the real reward was. And in caring is an
Mhm.
element of love. So caring is one of the most visible. And the intimacy was always based on the caring. The intimacy was so the choice. Well, what did it take? How many choices did it take for me to move from a self-involved guy, way longer than I should have been,
Mhm.
to an other involved and caring guy? It took the great work
Mhm.
to make that transition. And then it's about being authentic in communication and authentically communicating everything in a kind way. It doesn't help to communicate anything harshly, but sometimes you do, but you do the best you can.
Mhm.
Communication and responding to communication. It means that I'm not going to just tell you how I feel. I'm communicating for a purpose, and the purpose is to uncover what the truth is, and that's the purpose of the process. And then to abide by the truth. So I might start off by saying, you should have never done that. I don't do that anymore, but I used to.
Mhm.
Only to learn that I had started the whole thing off by
Mhm.
some, and the communication led to me realizing that I had made a choice that was hurtful, and I triggered the other person, and I was facing the trigger,
Mhm.
which I had started. It's a funny thing about relationship.
Yeah.
You come home one day and you say, well, she doesn't look too beautiful to me. It must not be my mate. When really what's going on is I've had a bad internal day and nothing looks beautiful and I don't look beautiful to me. I project it onto her.
Yeah.
Give me an example.
Yeah.
Well, she sees that. She sees that in my face, in my eyes, in my voice, in my demeanor. And she goes, she doesn't have a positive, great, wonderful. I'm just giving you an
Yeah.
example. So these things, you might think that your partner is not looking so good, but you might be the source of them not looking good. Frumpy.
Mhm.
Yeah, you might have
Yeah.
years of neglect and abuse and not knowing what love is and not being caring. And you get to see the face that you created in the other person, hung in
Mhm.
there because they loved you and they were courageous, but they couldn't withstand.
Yeah.
And that's a lot of the frumpy and dumpy is, my daughter-in-law has been loved for 33 years. This woman is just gorgeous. And she's herself. And, all of us is we assume the face of how we're feeling that day
Mhm.
or that moment. So, yeah, trust. In order to create love, we have to trust and we have to be trustworthy.
Mhm.
if we're not trustworthy, and there's many, many ways that we can be trustworthy, our partner's going to feel that. And it doesn't breed love to be untrustworthy. I'm talking about severe untrustworthiness or what can pass as minor untrustworthiness, where we're not being, they can't rely on us to do the household doings together. They've learned that they can't communicate to us freely, or we might be moody, or we might be reactive. This is trust at its most elemental levels, and being trustworthy. In order to love and have love, we must trust and be trustworthy. Some of the elements of what loving is. And why I brought this up, and these aren't the only factors, is you want to see your friend or your partner be beautiful, be loving, be consistently loving, be consistently trustworthy, trust, be caring, communicate, be authentic, reduce the fear of your partner, reduce the fear of your partner, increase the security of your partner. This is how we create love. Love is choices we make to create a phenomena called love. And if we don't make those choices, and then I say every human being has access to this, and there's a maturity that can occur for people who have been doing their own work and the great work, where the amount of love and caring that's possible far exceeds anything you could ever be when you fall in love. Oh God, yeah. It runs deeper and kinder and softer and more daily and more frequent. And I think you know that. I'm guessing that about you and your husband.
Yeah.
You have elements of this. So the value system's all screwed up.
Yes. Yes. The caring piece keeps on, like, the caring, just that word in and of itself, it's attaching to everything else. I mean, it's just like you said, that's how you're showing your love for somebody else. And that's how, when you feel like, caring for someone, them caring for you, that's what sort of keeps this all going. And that really, I don't know. It's just, it's such a basic word. There's so much to that word. It's attached to so many things in this throughout life, but in this period of life, I totally agree with you. The way that we are towards each other is really, we can see that in the other person, how we've behaved toward them. And if we are reactive and if they're reactive to us, and it's like, as soon as you, like you said before, kind of smile and say something nice, or even to the child, to react strongly or harshly to somebody, they're going to have this very strong reaction back. And when you acknowledge and accept and try and really show that caring human spirit, everything kind of dissipates and it just gets better. So it's really, I don't know, that word is we don't hear it as much these days. Loving is one, but caring is so huge. Yeah.
And for those women and those men who take that on, that they say intimacy and love really matter to me, and they do the basics. And, there's some people in this lifetime, they have the basics down. They love each other and they've been so blessed. They just have it. And this isn't a lifetime where they have to do the great work. Others have to do the great work. But when you take that on, and that's one of your values, you have access in your 70s and 80s to intimacy and love and caring that you couldn't even experience when you were 20. Wow. I can vouch for that.
Yeah, that's good. Hey, ladies, everyone. Yay.
So there's a big payoff. And what the real crisis is, that for many folks, not everybody, there's exceptions. I've seen people in cashiers in checkout lines, they had more love in their body. I had my blood drawn this morning by a woman who had so much love in her body, and she's probably 200 pounds overweight. And she was loving. It was like a healing experience to get my blood drawn by her.
Don't you love people like that? It's like just they're just dripping with it. It's like it's in their energy, you know?
You can never know what you're facing unless you're paying
Yeah.
attention, because they could have and so it's not there's so many different forms of a human being, but
Yeah.
you can have this.
Yeah.
And some people, it takes some work. And where the real crisis is, and this is the crisis that I've met up with as a physician so many times,
Hmm.
this is the real crisis of the change. That the woman gets it, that there's some work to be done, and she wants to go on that journey, and her partner says no.
Hmm.
And the woman's left with going on that journey herself,
Hmm.
i.e., divorce. And this is the tragedy.
Hmm.
It's a lot of women, they just don't want to do that for a
Yeah.
lot of good reasons, and sometimes for not good reasons. And divorce is I don't want to go into what that is,
Hmm.
but I do want to say that this is the crisis, because I've been working with menopausal women for 28 years.
Hmm.
And that's the roughest thing,
Yeah.
that they decide that they want to improve their marriage. They're not just taking their symptoms. They're not the identified patients. They're not going to let themselves become the identified patients. They're rattling around like crazy, but they
Hmm.
trust that they're that upset for reasons. And they're looking at what the reasons are. And some of them are about self, but some of them is about the partnership isn't going well.
Hmm.
Marriage isn't going well. And a lot of those women face, oh my God, I know I need to heal, and I want to go into therapy with my husband. I want to do these seminars. I want to learn. I want to read these books. I want to listen to these podcasts. And my husband doesn't want to do it.
Yeah. Yeah.
So they embark upon it. And the more they embark upon it, and this is the real tragedy, because this isn't always the case. Sometimes the husbands do. Sometimes the women have to be the leaders.
Hmm.
And
Yes.
women gave away the power on this earth. So women have to be the leaders to get it back. And sometimes, and I highly encourage women to be the leaders in their family. Don't take the initial no from your husband as the only thing he's going to choose.
Yeah.
Because if he sees you change, he's liable to go, hey, I want some of what she's doing.
Exactly. Exactly.
What was that seminar you took called I Want to Be a Better Person? Sign me up. I want to do it
I
too.
think that's often the case, actually. I think it's the women going
Yeah,
forward first
that's
and
right.
then, yeah.
It is. And and where the real tragedy is, or maybe it's not a tragedy at all, it's just the way things are, is sometimes the husbands don't choose to go along.
Yeah.
And then they break up the marriage. And that's
Hmm.
a hard thing. That's
Yeah.
a hard thing. But many women have done it. I mean, 50% of American marriages are ending in divorce. So it's
Yeah.
hard.
Yeah. Be neat if we could do that work leading up to it though, so we don't get to that
Exactly.
point, right? If we just could like to your point about unbusying or being in a society. I mean, I always think about the tents that you even talked about with, the week of a woman's period where you go into these tents and you're really being supported. And it's just like this dream, at some point that women get more, we are kind of strapped and spread thin because we're taking on so many things because we work. And we oftentimes, again, not all women, but a lot of the time are caring for the kids at home as well, or taking on that kind of double duty. And again, not saying each person is doing that, but it is a lot to put on a woman's shoulder. And then you do sort of everything gets put on the back burner. I hear that a lot from women, like later, 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 later. And it just never happens. And it's just, yeah, I guess to be continued because I know we're at time, but it's a really
Can I
good
say one more
discussion.
thing?
Yes, absolutely.
That the human race is in a relatively extremely primitive stage of consciousness in general. I mean, how could we possibly put our planet in jeopardy and
Yeah.
still be doing wars and still have economic disparity to the point where people aren't eating? and
Yeah.
people are homeless. I mean, we're very primitive in general. But the difference is there's millions, unlike when I was a kid, there's millions of American women and men who are choosing to grow and heal and become more loving.
Mm-hmm.
And that's what's going on. And it's sort of nip and tuck. Is this
Mm-hmm.
rising tide of healing and consciousness, becoming more conscious and more present and more loving, going to save us? And I'm just blown away. And I'm blown away by the elder women that I know, because that's the circles I travel in. And
Yeah.
there's beauty there. There is so much beauty. There is so much consciousness. There's so much fun because they're so cool. Because
Yes. I know
because
a few of those too, and they're just conscious. It is very conscious of all that's going on. It's so awesome, you
so
know?
anyway, that's also possible, and we got to make these choices as
Yeah.
individuals. That's the
Hmm.
thing. I had to make it as an individual.
Hmm.
There wasn't any group think.
Yes. Yes.
And
You
so you
came to
women
it.
who are facing a challenging change of life,
Hmm.
the change that you're looking for is you're looking for more love, coming home more to yourself, more to life itself, more to being present. And you know what? That's where the big fun is.
Hmm.
That's where the big love is. So it's a journey definitely worth taking.
Yes.
And so take the journey. It's rewarding. It's interesting. You meet up with some great people. You meet up with your sisters and brothers who are on the same path as you are, and it's a cool thing
Yeah.
doing this
Yeah.
together. And so that's how I'd like to leave it today. Do the
Gosh,
great.
that was so great. Thank you. That was really, really awesome. Such good insight, so many good stories, and I think the advice, and it's so logical and it makes so much sense. It's just we have to pause for a second to kind of think about it. So thank you, thanks for taking the extra time.